Michael in Normal wants to know, how is a child's hearing test different from an adult's hearing test? We can test people's hearing from birth to adulthood, so there isn't an age requirement. And there is actually a state law in the state of Illinois that all babies must be tested within 30 days of their delivery. So hospital systems typically have a testing system in place so that the babies are assessed before they leave to go home. But if the case is that they don't pass, then they can be sent to an audiologist's office for follow-up. So obviously with babies, we can't have them raise their hand or respond directly to sound. So we have come up with electrical tests that can monitor brain waves in response to sound. When babies are tested, there's two tests that are generally used. One is called an OAE, and when we perform that test, a probe is placed in the baby's ear, and there are clicks or tone bursts that are played, and the probe in the ear is also going to be measuring a response from the ear and making sure that there are normal responses at different pitches. The second test is looking for a response from the auditory system in the brain. So there is still a probe put in the baby's ear, but then there is also an electrode that is placed typically at the top of the head and then behind the ear. There's just simple adhesive, nothing is invasive or painful. And the probe in the ear is delivering sound, and then the electrodes are measuring the response in the auditory system. The babies can be tested very quickly, and we can get a good understanding of if their auditory system is working or not. As the kids get older and can start responding to sound, we can bring them into the booth and start playing games with them, or trying to get responses like head turns if they hear someone say their name, or we play a funny sound that gets their attention. And as they work up to being able to talk or understand speech, we will have them point to pictures or stack blocks if they can follow instructions. We move up into when they do hear the beeps, if we can get headphones on them, that they can drop a ball in a bucket or stack things in response instead of just asking them to raise their hand. It keeps them engaged in play and makes it a little more novel. We typically can obtain the same information through those test results that we can with a normal adult test. We just have to make it more fun and inviting for them to participate. A lot of times we'll see children referred to us because there is a concern somewhere in their development. Either their speech and language is delayed, or parents are concerned the TV volume is too high. And so in those cases, we just have to have a very good understanding of where the child is at in their development so that we can modify the test procedures. And maybe our results will be a little limited, but there should be some information that we can get in order to keep moving through the process of assessing the child and determining the next best steps. I'm Dr. Natalie McKee from Bloomington-Normal Audiology, and we're here for you.